Hearing begins as sound waves enter the ear canal. The eardrum vibrates in response to these sound waves. These vibrations travel through tiny bones in the middle ear. The signals are then converted into nerve impulses. The brain interprets these signals as sound. A healthy eardrum ensures clear sound transmission. It acts as a barrier, protecting the middle ear. Proper vibration allows accurate hearing. Balanced ear structure supports normal hearing. This system works continuously in daily life. Sometimes, the eardrum may become damaged. A small hole or tear can develop. This affects how sound vibrations travel. Hearing may become reduced or unclear. External sounds may seem muffled. The ear becomes more sensitive to infection. Daily communication may be affected. Damage can occur due to injury or infection. The protective barrier is weakened. The middle ear becomes more exposed. Medical evaluation helps identify the issue. The doctor examines the ear canal carefully. A small camera provides a clear internal view. The tear in the eardrum becomes visible. Treatment options are then considered. In some cases, surgical repair is recommended. The procedure is performed in a sterile environment. The goal is to restore the eardrum structure. The patient is prepared for the procedure. The ear is accessed carefully. The damaged area is identified precisely. A small patch or graft is used. This supports the natural healing process. The graft covers the damaged area. The eardrum begins to regain structure. The repair is smooth and controlled. The process is gentle and precise. The structure is stabilized. The procedure is completed safely. Healing begins immediately afterward. The eardrum begins to heal gradually. The graft integrates with natural tissue. The surface becomes smooth again. Vibrations improve, step by step. Sound transmission becomes clearer. The middle ear is protected again. Hearing starts to improve. External sounds become more defined. Communication becomes easier. The ear regains stability. The repair continues strengthening. Normal vibration returns. The eardrum functions effectively. Daily hearing improves. The risk of infection reduces. The ear maintains balance. Comfort increases over time. The healing process completes. Hearing clarity is restored. The ear functions normally again. The patient experiences improved hearing. Everyday sounds become clear again. Conversations are easier to follow. The ear remains protected. Hearing stays stable. The repaired eardrum functions naturally. Daily life becomes more comfortable. Sound quality is significantly improved. The ear maintains healthy function. The results support long-term hearing. Confidence is restored. The ear remains balanced. The repair provides lasting benefits. Hearing health improves quality of life. Eardrum repair offers a safe and effective solution.